So you should all see that, fallout from COVID-19 challenges and solutions, waste sector perspective. As many of you will know or guess, I'm not a health and safety specialist. I've done various bits of training through my career. I've had operational jobs as well as functional jobs. But what we thought would be interesting today was to give a kind of a business focus with some of the challenges given context in that process. So I'm going to talk to some of the challenges. I'm going to try and give a little bit of an insight to how different things change and how we try to manage them as a business through that process. Because obviously, none of us had really planned for this. And we were trying to balance a number of things. We were key workers, we were essential facilities and essential services, protecting our employees, being quite forceful with our customers and how our customers worked with us, both municipal and commercial. Now, Suez itself does water and waste as a business, but I'm going to talk about the waste component of that. We collect under contract from households waste. We collect directly with waste producers for business waste, so we do both sides of that story. I'm going to give a bit of insight to both of those as to how we did and what we did. We obviously treat the waste, some of the waste we collect in different facilities and how we manage that, and some of the challenges that we've had that maybe are unexpected. I think some of the obvious ones are there, but some of them are a bit more unexpected. A little bit where we host customers. So most of our activities, we go to your house or we go to your business or we go somewhere else. But some of them are, if you look at HWRCs, is where the customer comes to us. How we set about trying to understand how we can manage that. And we had some interesting and robust discussions with government about what essential meant and what the reason for an essential trip was. And I'm going to finish with a little bit of insight. I think behaviour, as you guys will know as we do, is a fickle thing sometimes. And actually from the different waste changes, we've had some really interesting insights to kind of attitude and behaviours of people that were working at home or furloughed or doing differently. So I'll give a little bit of that because I think it gives a light end to the process and maybe a few other questions. So without further ado, I'll start. So I just wanted to make sure, I don't know all of you personally, there's too many of you to know that, but to give you a kind of a picture of, a very simplified picture of what we do. So on the left, you've got a household. So, we pick up from millions of households. We have businesses, different types of businesses, light industrial through to heavy industrial. And we have about 24,000 customers in that realm. We collect in different formats, and we go and deliver those for transfer stations, DFSs or MRFs, sorting centres, or they'll go to, generally for us, energy from waste, but it goes into landfill. And then you'll see that householders also make use of our household waste recycling centres. So a very simplified system. And as with all things, it doesn't quite represent the fact. So what I thought is I'll put in and say, well, actually, this is what happened. So in the UK, there's 24 million households. They're all being collected by somewhere between, depending on the definitions, 300 to 440 local authorities, over 100,000 waste carriers, 5.7 million SMEs, and 100,000 corporations. Now, most corporations like ourselves will have people responsible for health and safety. They would have taken a lead role in COVID, and therefore we had a very professional and a very like-to-like discussion with those customers and kind of how we were going to work with them and how they will work with us, or how they need to present their materials to us and vice versa. You can imagine the 5.7 million SMEs, many of who were struggling with coping with COVID themselves, were generalists rather than specialists. They were having to deal with how the chip shop's going to operate, that sort of process, and we're there going, how much do you need us? So we then took a role of going, okay, how do we educate our customers that keeps our staff safe and make sure they understand what they need to do and how they interact with us? And of course, collecting the waste is only one of those parts. As key workers and essential provision, we had to make sure the whole system worked. And I'll allude to a little bit, we had one of our energy from waste plants in Cornwall was just going into shutdown. So every year we close them down, we refurbish and maintain and improve them, and then we bring them back up again. We normally do that in a period which is relatively quiet. And this period, this plant was coming offline as COVID started to hit. We were under pressure from the customer to get back up and running. We had lots of specialist contractors from all over Europe coming in to do that work. Some of them were worried about going home. Some of them were worried about the systems. We were having to innovate a little bit on how they would work and how they our shifts and our key critical staff. As you can see, super complicated system, many different ways of materials moving. A lot of those materials were appearing contaminated with potentially contaminated PPE from householders and businesses who weren't quite sure what to do with the material. The aspirational recyclers were putting their face masks in the recycling, hoping that we could recycle them, without really contemplating the impacts of us on having potentially contaminated material in those streams. You can see super complicated, and a stream that requires all the components to work. And I'm going to pick up this. So we did some early surveying work of what's happening in the system, and then ADEPT, LARAC and others started to pick up that and survey themselves. So if you look at collection services on their own, so residual is that grey bin or the waste that you can't recycle. Most of the services were maintained or only lightly disrupted. They were an essential service. They're the one that protects human health in the home, make sure that we don't have waste festering at home and causing infestations or biological issues. Recycling, that's dry recycling, less contentious at home. Generally, it should be dry, should be able to hold it longer. Garden waste, it's not necessary for certainly for households, an obligated service, and home composting is a viable option. So you can see there that a lot of those services, nearly 40% of the services were withdrawn. Part of the reason for that, it wasn't essential. Part of that is we were taking crews that would operate those garden services and helping support the other key services like residual. So we're moving drivers and others around the system just to make sure that we had enough for those truly essential services. Same with food. So food was reduced. In some places, the food was put in the residual. In some places, the food continued. It was always collected by one of those two services. And again, it was down to exactly how that was being collected. Bulky waste, that's normally an ordered service. You contact the authority and they come and collect it. Those crews were almost always sent off to support other services. So bulky waste collections from home were taken out. At the same time as this, we were closing the household waste recycling centres so the public didn't have access. But at the same time, the government didn't want them to make non-essential trips, and removing that old sofa from the home wasn't deemed by us and government at the time to be essential. Clinical, obviously, highly required and another essential service that was maintained. That's not a household service necessarily unless it's so special. And street sweeping carried on as best as possible. So you can see big disruptions, and this is the 3rd of April, so this is at the start. I think this one, unfortunately, they changed the graphics, so it changed a little bit. But here you can see, if you read down the curves, that residual is still up there, almost invariably operating with only minor disruption. Recycling just started to pick up again, because you can start to see the columns represent individual weeks. So you can see across the bottom, week 1, week 2, week 3. So gradually, as you go to the right, that's the nearer time at that point. You can see that we were improving the recycling, they were coming back online. Initially, we had a lot of people self-isolating because of people in their home, or suspected cases rather than actual cases, because at this point there wasn't a lot of testing going on. Food was fluttering around but fairly stable. Garden waste, a little bit of an increase as things settled out by this point in time, but still a lot of services that weren't working. And you can see again the bulky waste, small improvements, some services coming back, still the majority of them were turned off. And again, this was about sharing and making sure we had good resources. But it wasn't just in that process. And I coined a phrase that you'll see later on that through COVID, when we talk about waste from municipal sources, Christmas came every day. That's not a good reflection, but what we have at Christmas is we have everybody living at home. Most businesses are shut down. So in effect, Christmas was COVID, but without the COVID. And we have a flush of material, people consume more, there's more people in the household, so we have a flush of waste, and we call it the Christmas rush. But what we had with COVID is, with businesses shutting down and lockdown, we had all those people at home day to day, every day, for weeks on end. And as you can see here, so the columns represent the estimates from the different local authorities of how much more waste was being generated. So on the left, you've got residual waste, and over 40% of the authorities were having increases of up to 20%, and just under 40% were showing increases of 20 to 50% in the volume. So not only were we trying to maintain those essential services, we were having to cope with huge increases in the volume of waste being generated. So when a truck could do, for instance, 1,000 homes or 2,000 homes, If they're producing 50% more waste, then it can only do a proportion of those before the truck's full. But we then had more returns to tip. We had longer shifts. We had lots of challenges around making the resources for what was the new conditions. And you can see there we had the same in recycling, we had the same in food. Not surprised, we're not eating out, we're eating at home, we're generating more food waste at home. Through that process, so lots of material flying around. And then if you see bulky waste, either no change or small decreases because we weren't collecting in the household. If I flick to June, and here things are starting to be relaxed, people have settled into a new routine, but we're still seeing, a large 60% of authorities nearly seeing up to 20% more residual waste, over 40% seeing up to 20% more recycling waste. So although it declined a little bit, we still saw a huge increase over that period of materials coming in, which was not only a stress for the collectors, but then all of that material has to flow through our sorting centres, our transfer stations, and our treatment stations. So lots and lots of issues with regard to tonnage. And if I look at then at Christmas Day, every day, so over that period, huge amounts of more material flowing through, different challenges, different squeezes in the supply chain. We didn't have it ourselves, but some of our peers in the market were struggling because of the design of their sorting centres to actually get throughputs. They were constraining throughput to 80% of what was normal. At the same time, we were seeing 120, 130% of the waste that we'd normally see. So there were big gaps in the system in terms of capacities and shortfalls in the ability to treat materials arising. And we were having to deal with that. We were getting requested to take more material. We were having to make changes to our staffing levels and our processes and assess those under COVID rules and COVID regulations in terms of that process. Very much high levels of activity. So if I then take the services in their component parts. So household collection, what was the key thing? Well, we had to keep the essential services running, residual waste, food waste, that sort of stuff. Residual had to be maintained, and here, strangely, some of the Brexit planning we've been doing over the last 2 or 3 years was there, because under Brexit, there's issues with regard to potential fuel supply, drivers, etc. So some of the contingency planning for Brexit worked quite neatly for this. So we already had some planning about what we do, how we'd prioritise and what we do in that process. Food we maintained, dry cycling we maintained where possible, but we gave instructions to hold at home or worse, put it in your residual. But obviously, if the household had put it in a residual, they increased the volume of residual waste, which created even more issues for us in the residual collection. So we really didn't want them to put it in the residual. We wanted to recycle them, and we thought a hold at home where possible was a good answer. Green, more difficult to hold at home, but certainly possible to treat at home. So there were guidance going out about home composting. Those processes deal with your waste locally. And another waste generally will hold at home, obviously clinical wasn't. We moved crews from the commercial waste collections and from other collections that were being reduced, like green waste and other ones, to support those services, but often the requirements of those drivers, certainly the crews from the commercial collections, we had to retrain them a little bit because the household collections are very different. So we went through a process of retraining them. We closed almost all of our HLWRCs because they were deemed not essential in terms of the visits and the public weren't essential. So we closed them. We moved a lot of those staff to support our treatment centres or our collection centres. A lot of the drivers that support those were moved into driving essential services. So we did a lot of resource movement, a lot of retraining, and managing their retraining at a depot level, which I'll get onto in a second. And in some of the collection systems we changed. In some areas we have source separated collections where we collect the materials in different streams. So you'd have a plastic stream and a metal stream and a glass stream separately. They require more staff than a collection where we put all the recycling into one bin and throw it in the back of the truck and we sort it mechanically at the other end. So we had to change some of that where we didn't have enough staff. So we brought in some co-mingling recycling instances to make sure that we could continue those services. And in many ways, we worked with the customers on changes to service. So the customers had requirements. Actually, just at the start of the lockdown, we were trying to mobilise a new contract for Somerset. Something like 250,000 new homes, new households were getting a new style collection. So we had to cope with COVID whilst also doing mobilisation, whilst also inducting new staff, getting them into the new systems and new collection systems. as we did that phase introduction. So not without its challenging itself. So what did we do for our staff? Well, we had crew and cab bubbles. So we made sure that as far as possible, the crew and the cab were the same every day, so that we didn't mix bubbles. We weren't then having to rely on decontamination for the truck because we put the same people in the same place. We moved staff around. We trained them in the depot, and we buddied them with experienced crew members. So there was never a point when they couldn't ask a question of, or someone else wasn't just looking out for them in that process. That helped us bolster the staff member access to crews and filling gaps for people that were isolating or ill. We staggered the crew visits to the depots, so they were staggered so that it didn't cross with other people, again trying to prevent those bubble breaks. So again, we had to kind of reorder the shift patterns a little bit and the arrivals and the departure points. Where we could do, we put crews on collect en route where feasible. Again, it's not always possible, and sometimes there was a bit of a route chopping and changing because someone's on one route, but they don't normally work on that route, so we did a little bit of that. Again, just trying to create bubbles that we could then protect and prevent bubble breaks. We had one contract where we took what were local authority school minibuses, and we used those as tag-along. So effectively, whilst the truck was going along doing the collections, the crew were out doing their normal work. But when they were on the intermodals, when they were going from the depot to the ship to the route, or going back from the route back to the depot, we would then do a minibus where we could do better separation in that process. So we did that, and again, that was more where we had heavy crew requirements in the stitch collection. We put in place cab cleaning, so we did deep cleans before and after. We intensified those, creating the new not only standards of cleaning, but also the risk assessments for the cleaners in those processes. As I'm sure many of you are aware, the WISH guidelines we were following and updating, and they were being updated continually. So we'll continue to have to review the guidelines as they came out and input into the sort of things that we were finding. And I must say, through the process, our COVID contamination rate as a company was very low, lower than the national average for people that were, I think, self-isolating. So many of these things were very successful in keeping our staff protected. When we look at treatment, so once we collect it, we then move it on to treatment. First thing, obviously, any staff that didn't need to work from an operating location were to work from home or other locations that weren't operating. So we wanted to reduce the potential for infection being brought in by not having people that didn't need to be there coming in. We created shift bubbles, and again, the shifts were staggered, so we made sure that shifts didn't cross, and we did cleans between shifts. Where we're using contractors, sometimes they form part of our bubbles, and sometimes they form their own bubbles, but we expected all of them to work to our standards, and we gave them all the standards we expected them to work to. Again, the same processes, they just became associated bubbles. Some critical staff and certain roles were given tighter bubbles, and some of them almost down to an individual level. Certain key critical staff were then almost given their own little bubble as well, and they had unique routes. They had protected zones that were for only for them, and that sort of process. So we did that very essential kind of critical role to make sure where it wasn't going to be an easy cross-train, that we had those roles as protected as we could do through that process. And where possible, we put non-essential maintenance work on back burner and carried on with only essential services. And as we got better at understanding what was good, then later on in the process of the lockdown, we started then to pick up that non-essential work because we had the right procedures and everybody was comfortable and the habits were there that we could actually deliver. So PPE and other matters, like many people, getting hold of COVID-related PPE was an issue. We had to lever lots of our international company links to get some of the materials. We started to track them. So I remember having discussions with materials being stockpiled in Dubai airport and waiting to ship. I remember one production being stuck at Auckland in New Zealand. Again, we had to become far more active to make sure things arrived in the right place at the right time. Managing stocks, we put in place central distribution places so that we maintained and controlled the distribution to everybody, so that everybody had what they needed, and that we didn't end up with places with more than they needed and places that didn't have enough. but that was a real challenge for the first few months of the process while everything settled down. We talked to and took a lot of experience from our overseas businesses. We operate in 56 countries around the world, and a lot of those countries were months or weeks ahead of us in their lockdown process. So we took a lot of their feedback on what worked well, what didn't work well, into our own activities and our own process, and that was super useful. And actually, once we started to do that, we were able to see as their lockdown released what worked well for them in terms of getting back to a more normal. And we've mirrored some of those in the UK as we've started to bring people back in different ways and different processes. We did, I had the wonderful duty of reporting every 2 weeks to DEFRA and consolidated a lot of the information around critical staff absence, essential plant availability, material flows and PPE, and we were doing that every 2 weeks, having quite a lot of dialogue with them in terms of making sure that we as a sector had enough of the right resources, people and equipment to keep those essential services running. Now, commercial collections from businesses, because of short lockdown, they declined massively. And I thought, a quick graph, if I get my top slides all right around, to understand exactly what that means. So here, this is just Suez customers by sector, a few customers, and that's the revenue change that we had. So you can see that manufacturing had a delayed response. A lot of manufacturing businesses really haven't seen the downturn in some places, and that manufacturing, we think, is linked to supporting essential services, for instance, the army or government operations that continue to require them. But where it's manufacturing supporting retail, obviously there were big drops. And you can see some of these are significant drops. You know, accommodation, food service saw something like an 80% drop in activity. And therefore, because they're not open or they're not as active, they didn't need the services from us. So they were then going through looking at their staff, reallocating. So super interesting, but challenging times for that part of the business. But obviously with commercial collectors, we're going to the location of the customer. We're sometimes having to go onto their premises and collect their bin. Sometimes they present the bin to us. Sometimes we have to go and get it. So we then put out quite a proactive push to customers. So, okay, here's our procedures and this is what we're expecting. So here's just an extract from one of the letters we sent. And this is what we're expecting of our customers. So good hygiene practices from their employees, so that our staff are protected because they're protected themselves. We want their staff to be avoided. We don't want the staff coming out and trying to shake the hands of the driver or approaching the driver and infringing on his exclusion zone. So again, making sure they understand what's right, what to do with materials, what good hygiene means, and again, making sure that we lift their standard to one that we think is appropriate and protects our staff. And also a little bit about us making sure that the services, the bins and things that they're using are correctly done. So if they are storing materials for 72 hours before they put it in the bins, make sure they don't store it out the front of the shop, they store it in the back. So the processes and that those bags are intact when they put them in the bin. Regular reviews, pointing them to guides to look at, and also asking them to update them if they have a case, because again, then we'll look at that on an individual basis and see whether we need to change our processes to protect our crews or protect the value chain beyond us. So quite a pushy approach to customers. With HWRCs, obviously we closed them first off, and I just put this one up. This is very early on in the process. As you can see on the HWRC one, almost everything is closed, very few are open. And again, part of those crews and part of those staff have been transferred elsewhere. And part of it was where we didn't really, a lot of the visits that the customers would do would be essential. We didn't want to come out of their houses and move for what was material they could hold at home in that process. There was a lack of guidance. There was an awful lot of talk. There was an awful lack of desire for what looks good. So we did 2 reports. I was the author for both. Just looking at the first one was really the principles. Why would you want to reopen household waste recycling site? How would that work? In principle, why would people want to bring? What should they be bringing? What sort of process are kind of setting out? That was done at the start of April. And at the end of April, as things started to move, and DEFRA had published a little bit of their own guidance, there were a few other bits of guidance documents out there, where we just did one on a practical consideration. So we started, we'd done some trials. We'd the different organisational structures on these sites where people come and park, and how we would organise ourselves. Often these sites are very individual. Some of them are smaller, very compact. Some of them are large and expansive. But we were then kind of managing those. So we've done some trials, we learned from those trials, and we then applied those into this guidance. And we put in that document things like how you might want to arrange. So here you can see on the top right, just if you've got one where you've just got bins and car parking in front of them, that you close every second parking space, that it's one in, one out in that process, and that you get, say in this instance, car one accesses 2 bins, so that you don't get people crossing. And if you've got multiple bins, you want to open multiple materials. We then did in the bottom example where you could actually control that process with multiple cars and multiple bins, but making sure again that people don't cross or are forced to cross by isolating areas and doing the process. And we didn't do this because this was saying this is the perfect design. We were trying to make sure that everyone was thinking the right way, and as a sector, we took a common approach to the process. This is our contribution to that journey. But also we have to look at what happened outside the site. If any of you have been to some of the HLWCs, you'll see queues outside them, especially at bank holidays and busy times. So again, we had to look at and go, okay, within the route of what we're doing, what was important. So we had to provide a safe access for servicing vehicles. There's no point in the bins filling up if you can't get a vehicle in to empty them. Safe access, so making sure that people, we could store people, that we could hold vehicles at the entrance and not put our staff or people in the cars at risk. That where we're in neighbourhoods, neighbours are moving around, that we don't stop them doing their essential trips. That we allow other traffic that's not necessarily neighbourhood to do their journeys. That emergency services can attend sites and nearby to the site, and make sure that we were as good a neighbour as possible. And what that drove in many instances is that a lot of sites went to booking, or some sites went to kind of odd number plate numbers or even number plate numbers, just to manage access, manage the throughput, so that we didn't end up with large queues and big issues in the surrounding environments. We also looked at essential, and it was really difficult. So what is an essential waste? We all have a perception on that. So we looked at that and said, okay, if I'm a householder, what does essential DIY mean? And we did this for a number of different waste streams, but we looked at, well, if you've got a pipe leak and water damage, then that's essential. You need to make your house safe to live in. You need to make it electrically safe. You need the heating to be working safely. You need the building to be weatherproof, and you need to be secure. And if you're doing DIY or getting a contractor in to do all of those, then we felt that was a reasonable definition of essential. Again, just managing people's expectations of why they should want to go to HLWC. The guides at the time was don't leave your home unless it's necessary to do so. We also had lots of new waste. So what to do with the infected waste? That was relatively easy. The 72-hour hold and things like that was quite clear. But obviously, there's a normal majority of people didn't know they were infected or they weren't infected. So we had lots of items that were potentially infected. So what do we do with those? How do we approach that? Does it mean that if any PPE, whether you know you're infected or not, is held in the residual for that period of time? Depends a little bit on how we treat the residual. Litter, ongoing issue, and we see it still today. Mask on the floor, you have no idea what's contaminated. You can't leave it on the floor, so you have to pick it up. So we don't get the protection from the 72 hours, and we had to look at our staff and make sure that in those instances they were suitably protected. And then there are some recycling services, some of these items, but as the general guidance is 72 hours hold and put in the residual. We then had to go through with our partners some EA approvals to make sure that we were not, the service was an accepted alternative treatment system. And then finally, habits, and I'll give you a little picture on this. So the pictures go left to right at the top and right to left at the bottom, so you kind of read them in a clockwise way. So very early on, so this is a graph. This is a star diagram of representing the type of waste we were getting. So this the one top left is 25th to 31st of March, and we were looking at where we were. So if the figures in there are red, then they're less than we'd normally get, and if they're in the black, they're more than we're normally getting. So you can see things like that. So tin cans, we were getting slightly more tin cans, we were getting more recycling than normal, and actually at the time we were getting more healthcare type waste than normal. So we started to see a little picture. If you then go on a couple of weeks, the next one you can see a big spike in tins and cans. Part of that is driven, and at the starting of a peak in glass. And part of that is, obviously, you remember people hoarding. The shops were empty, people were buying lots of things they could store, and in lots of things they could store were tins and cans. At this point also, I think lots of people that were working from home were furloughed and living at home. Life wasn't necessarily interesting, so we saw an uplift in alcohol sales, and we saw therefore an uplift in glass arriving. Again, auctions on trucks changed. Then go on again, and what we then get is some decline in some of these materials. People are shopping normally, so your bean cans and your tomato cans are going back to a more normal position. But then we get a peak in plastics, and that's some of these pastas and other things that are coming out from people having stockpiled and stored in a different proportion. Go on again, and you start to see that we've still got high plastics and mixed recycling. We're starting to lift up things like bulky waste and things like that start to come in as people react. And then just at the bottom left, the last one that I presented here, a peak in bulky waste. Why was that? That's because bulky waste collection started to restart in the system, and therefore we were bringing more materials in. So you can see that part of this was behaviour change on the public, and part of this was service change from us. But a truly interesting insight to what people do in situations which aren't normal in lockdown and COVID. And very much Suez took the view that we would intensively monitor what was going on, we'd give as quicker feedback as possible internally and externally to ourselves, to our staff, to our customers and to government as best we could, as to what was happening, so that they therefore had the right information at the right time to make the best informed decisions they could. So is that the end? Well, unfortunately not. We're doing a lot of work as a business. We've got a predictor tool now that works at a depot level that predicts how different sectors will respond in different situations. So we're monitoring and modelling lockdowns. We're doing that because that allows us to tune and make sure our services are always appropriate to each of those areas. As you can see from previous, because we've been monitoring the changes that happen, the different waste streams, the different volumes that appear, we're able then to put those in and start to understand, it's not perfect yet, what the impact of a local lockdown will be, and make sure that we've got our services tuned to accommodate maybe increased volumes from one part of our value chain, but less from others in those processes. Obviously, we've started to see from Monday some national constraints as well that will start to impact. And on top of that, we've got schools. So in the end, no, just part of the journey, but an interesting journey. So thank you very much. That's me done.
Okay, thank you very much indeed, Stuart. That has been extremely interesting and useful. And first of all, from a personal point of view, I think a big word of thanks has to go to the whole sector. I think the fact that people's waste was collected when everybody else was panicking and stopping, I think full credit needs to go to everyone behind the scenes to make that happen across the sector, not just with Suez, but across the piece. And I understand the concern regarding all the various iterations of the WISH emergency document put together by the likes of Chris, Tony, and yourselves and across the sector. And I think the people involved in that iteration, the various iterations, understand the challenges of face masks and why the government, people want to make a big issue about the indecisiveness of government. I still don't think that the debate between face coverings and face masks has yet been answered finally. I think there's still research going on one way or the other. Is that a fair comment to make?
No, I think it is. I think that the whole issue of hand to mouth, and I think it's interesting, you see many people that are interviewed with masks, you often see them putting their hand and readjusting because they don't sit properly in the mouth, or they're coming across the nose as the jaw moves. And obviously for our staff dealing with waste, we encourage them not to do hand to mouth at all. So there were some real challenges and some real debates going on with our health and safety teams and operational management. And we kind of took the decision that we thought that face masks would often encourage more hand-to-mouth activity. So, and I don't think the WISH guidelines were anything more than really useful. But they were progressing. We were learning. We were understanding. We were faced with different challenges. So, I think the iterations were a useful progression, and I think in years to come we'll look back at them and go, look how we learned. And hopefully we'll end up something that when we get the next biological issue after this one, we'll be able to pull it out and learn from it directly.
I mean, IOSH did engage both Public Service Network and EWNG did in the early days. I think once the ball got rolling, things were far more successful. And I think picking up on the challenges you had regarding that, you mentioned retraining of people, obviously being more waste to be collected, therefore more weight in vehicles, therefore more trips to tips, etc., and transfer stations. Did you have the extra challenges of having to train or get hold of vehicle drivers?
So what we did is we moved a lot of our people around. So obviously we were cannibalising some of the non-essential services to provide the resources for the essential services. We also, as a business, because we do commercial collections, and the commercial collections have died quite a lot, we were able to move people across. But obviously, a commercial driver does a very different job to a household collection driver. So we had to put them through an induction. We did those at depot because we felt that was most appropriate in a safe way, but an appropriate way. And then we buddied them up. But it's very different. It's a very different style of collection. Generally, you're in the cab more on a commercial collection. Often they're single driver operators, and then they're working with crews. They're doing different things. They're having to watch different things. In that process, the bins are different. The bin lifts are slightly different. And some of the services, obviously, you go to steadies, you're doing lifts with boxes and stuff. So, it was appropriate to get them done, and they were invariably brilliant in what they did. So we were able to move across. If we hadn't had our commercial team available, we would have struggled, I think, a little bit. But we were able to cross-move them and cross-train them, and that gives us future resilience, I think.
And the other little point, I think, because we've gone through almost a channel shifting of people's behaviour at work or in society. In some of the personal hygiene issues, do you think, I think in ways, have we changed? And I ask that because you have other, we don't just have COVID-19, we have the whole wealth of sicknesses. Are you aware of any data regarding days off for employee for virus and flu? Has that reduced over the past 3 months as well?
So the data I've seen, and it's not something I'm on to continually, but the data I've seen and the comments I've had with my health and safety team is actually, yes, we've seen some benefits from a higher level of respect for what we'd normally expect for hygiene. I think people are taking it seriously, and it's one of those things that if we can fix that habit after COVID and keep it going, will make us far more resilient for the kind of noroviruses and other things that we deal with year on, year out.
Brilliant. Some of the questions and challenges here, which may provoke other ones. Obviously, the closure rates and the change of arrangements at HRWCs has raised a few comments. I think the first comment is, has there been an increase in fly tipping that you've been aware of? And are you aware of any challenges in terms of, through local authority, fly waste teams of more work being done collecting it?
So I think on the fly tipping one, this was subject to a lot of debate at the time. So some authorities reported an increase, some reported a decrease, some had no change. Often a lot of the, I think for me, when I looked at the data, a lot of the increase was down to the man in a van Facebook style, I'll come and clear your rubbish for you, Governor, don't worry. So it's slightly more industrialised rather than household. And it was the householder not necessarily following their duty of care or understanding what they should do and making sure that happened. But some authorities did report an increase in fly tipping, but certainly it wasn't across the realm. I think generally the public understood. There was a degree of frustration coming in towards the end in terms of other things were starting to open and can we get them in there? And we started very much opening for those wastes that you wouldn't want to store at home. Part of that was because of exactly that reason, and part of it was because we'd moved from almost an open access in many of our sites, turn up, wait in the queue or drive in, do what you do and drive out again, to making sure that we can control access, that we can maintain safety, that we can keep our staff safe, that we've got enough of the supply chain after that to get the materials out, and operating hours sometimes moved. We've had a lot of commentary, certainly Suez has, from customers to the HWRCs that say actually they prefer a booking system, because actually you book at 11 o'clock, you turn up at 11 o'clock, you're not worried about queues, you get in, get out. And there are efficiency improvements, so obviously reducing the amount of traffic and leaving more space means the throughput goes down. But we do think that the resource management that comes with that, so we should know from the booking system whether tomorrow is going to be busy and when during the day it's going to be busy, which means we can prioritise staff. That means we can associate cleaning and other bits and bobs at times when required. And that's been an added bonus to the process. Okay.
Still on the subject of household waste recycling centres, obviously and this is, I suppose, and we have two opinions here. There's two views from questions. One, of course, is we stopped garden waste collections, or didn't restart them at the start of the year because of COVID-19, just around about Easter, just when the gardeners are going out getting all prepared. And then we shut the household waste recycling centres and told that your one compost bin, because compost takes months to become usable as a nice whatever a compost is. So we're having these competing things, and part of the frustration was, I think, that the arguments about all the segregation, different issues, why the household waste recycling centres couldn't just be open on a 1 day a week for garden waste only, so people queue up there. You have all the skips for garden waste, and you don't have any changes for elsewhere. That was a comment made, but someone else has said actually they didn't like the idea of the concept of, so some centres did split into only one type of waste at a time, which meant they had to make 3 trips there. So by the sound of it, you're not going to please everyone all the time, are you?
It was really difficult. We had a lot of discussion with government because at the time it was law on essential trips. You weren't allowed to leave the house unless the trip was essential. And the question was taking your green waste to the HWRC an essential trip? Now, ultimately, government, having had that argument with the government, and we had a different opinion to them at that point, they did change the law that said that going to the HWRC was an essential activity, which meant that they didn't need to justify the trip as being essential. But we were potentially, if we opened a HWRC and encouraged people to do non-essential trips, then in fact we were making the position worse. So there was a little bit of definition change between everybody as we start to understand what that was. Now, some sites continued to remain open, not every site closed in that process. And then as we start to reopen, and again, most sites, you have a range of bins. You park your car, you take waste number 1 to bin number 1, you take waste number 2 to bin number 2, and you're crossing and passing paths with lots of other people. And you're also carrying items. So you're distracted, you may be heavy, it may become more difficult to lift, those sort of things. And we didn't feel it appropriate at the time that we encourage people to cross while they're distracted. And therefore, part of the restriction on the types of waste was also just to manage access and keep people separated. And at the time, masks weren't obligated at the start of that period. So government was also fine-tuning its advice to the householder, and they were getting used to what the new normal was. I think now, if you look in most shops, it's abnormal to see someone without a mask. But at the time, people weren't in the habit of wearing masks. It was difficult for us, if one person uses the handrail up to tip in the bin, do we then have to clean the handrail? And you saw that, Transport for London, where it took them a while to get to their more resilient cleaning system. And we were going through all those machinations. So we did understand the frustration, but certainly for the first delay is the trip essential? And then once we determined that the government wanted us and was going to make them essential trips, it was then a case of how did we open and manage the pent-up demand? And again, it was about just managing the return and in many ways putting in new systems. So a lot of the authorities that we work for put in the booking systems very quickly. It's funny how sometimes stress drives innovation, and that was delivered very quickly, and people were booking themselves in, and the service was great. And then what we had to do then is try and increase the capacity as people moved. But yeah, green waste from your garden, it was a pain, but storing it as other people do wasn't going to create health issues for the period that we were in that sort of essential service maintenance period.
Okay, thank you. Martin, you've asked a question. What is your advice on EWC codes for infected material? i.e. face masks, face shields and other PPE that gets discarded, and should you separate this from general waste? I think you kind of answered this about the 72 hours, didn't you, earlier on?
Yeah, if you know it's infected, then it should be treated as low-grade clinical in effect. If you're not sure, and that's the majority, if you're using them, then the idea is to put them in a bag, hold them for 72 hours before you put them in the bin. So that means that if the bin breaks, not the bin breaks, if the bag breaks when it's being tipped, or in some places where we do bag collections, our crews are protected, because by that point the virus should have become run its life in that process. And then in small issues, some of the PPE like face masks can be recycled, but we have to collect it in a very different way, and it goes off for specialist recycling. But again, it's an approved method, and it's not for general consumption for the majority of the population. It's hold it 72 hours in a bag, double bag, in a bin, and we'll do it through the residual waste.
Okay. Bogdan asked, thank you for the presentation, and saying that customers' habits during COVID-19, did any of that affect the health and safety of the employees, i.e. significant changes in risk assessment, method statements, whatever? I think I'm trying to find out, trying to interpret the question. For me, I suspect it's people being frustrated, I think, and maybe for aggression and whatever, violence. Is there any increase in that at all?
It was a consideration for the HWRCs, and some of our sites or some of our contracts were in transition where we were managing commercial waste, which shouldn't really be going through them in a different way. So unfortunately, violence isn't uncommon. On a street basis, I think it was almost the reverse, and you saw people decorating bins and marking on the ground rainbows and clapping for the binmen and stuff like that. And in many ways, it was the first time, certainly as a bin man myself, in the industry for many years, that the service we provide was recognised, and people kind of, my bin's been emptied and I'm really grateful. If you go back this time last year and ask people would be grateful the bin emptied, it's essential, it's just a service, it happens, but people appreciated the work they did, and I think that gave our crews, our field staff, a real feeling of worth. I think we value them highly. We know the service they do, but I think sometimes it's an invisible service. You put your bins out, you put them back when they're empty, and you often don't see the crews. And suddenly they were visible and they were being welcomed. So we didn't see those things. I think sometimes when people are trying to give you gifts and things, it's difficult because you don't want to say no, but in the same place you don't want to say yes. So it was managing. So decoration of the bins, as long as they didn't increase the infection rate. The chalk rainbows on the floor were great. The pictures in windows were great. But no, we didn't really have that issue.
Brilliant. So Paul from Torbay, who said that down there they've seen a far greater increase in cardboard waste attributed to online shopping. Did you pick that up at all locally elsewhere? Was that the trend?
Yeah, so part of that dry recycling increase is just people buying more, because at home, lots of people, I think, were going through tech changes. I'm working from home, I'm using my computer, it's not good enough, I'll change it. But yeah, there was a big influx of hard card, OCC, through that process. As with other changes, you see people reacting slightly different ways. And it creates quite a lot of volume, because it's structurally sound, so it creates air gaps and things, and it's already got air gaps built in. So yes, but part of the general trend, we saw more of most wastes because more people were living at home more often and more time during the day. Normally you'd have maybe breakfast and dinner at home, lunch away, and now you're having lunch at home as well, and you're living at home and you're probably snacking a bit more than you would normally, and you're ordering a few more things and those sort of processes.
But it's worth noting that I'm right in saying your waste data is on weight, isn't it?
Yes, it is, but where you see me doing it splits on composition, that's it's mostly weight, but it's split by the different materials. So we've been looking at what we get through our sorting centres and then breaking that apart by the composition.
Okay.
That sort of process, but also the feedback from the staff. You know, when you're lifting a bag of cardboard and you get used to roughly what's in the bins from a normal set, and then people are coming back and going, oh, there's loads of this, which comes back to my comment about Christmas. You know, lots of people get parcels of Christmas, so it was like Christmas every day.
Okay, thank you. Next one is about, I think I'm challenging the question as well. I question, someone's made an assumption for the bin handlers or the bin men. The primary risk pathway would have been contact as against insulation. How was the risk managed? So this is back, so is the question right? What's the primary risk? Inhalation, working together, the breathing in the cab, or was it handling bins? And was it any greater than it would normally be? Because there is bin men are always told to keep their hands clean, personal hygiene, aren't they? From that point of view.
So we did increase the in-cab availability for hand sand, stuff like that. We did change some of the crews to reduce the number in the truck. I talked about the tag-along where we've got bigger crews. The cab was continually a point of tension, I think. But protecting the crew, keeping their bubble going, and making sure within their bubble they work, to making sure the equipment they use is clean. Obviously, they're continually picking bins up, so every time they touch a bin, there's a risk of cross-infection. And it's making sure that we keep that outside the cab as much as possible and keep them as clean as possible in the cab. But very much that's protection. But yeah, there were lots of, I wasn't party on, I don't lead on health and safety, but our health and safety crews did lots of work and risk assessments around how to keep crews safe in that process. Do you put a mask on them or take a mask off them? And again, put a mask on, if you take it off, then it's hand to mouth. And again, the hand to mouth risk we saw as quite a big risk in our business.
Okay, I'd ask at this point, no more new questions come in, please, or we're going to keep Stuart behind here all the afternoon. So I keep thinking we're getting the numbers down, but another one comes in and says the answer one. And I think one you've answered before as well, because somebody's actually said that for an admin department in a healthcare setting, they were told to put face masks into general waste, as is done in private households. This is back to your question about if they're actually not infected, then it's, you know, it goes into the waste and it's just treated accordingly, because they're not actually, these people in the offices and things like that.
Yeah, so for commercial, you treat it, precautionary principle says you treat it as though it could be infected. If you know it's infected, if you've had cases, then you should be treating it as clinical because it's known to be infected. If you don't know it's infected, then it's the bagging, holding, that sort of process was a recommendation for everybody, householders or businesses in the same process. Because we will ultimately empty the bins, and then when we take the truck and tip it into a transfer station, we've got heavy plant moving it around, the bags get broken. So what we want to do is make sure the whole chain, so less the crews alone, but also the crews and then the workers in the transfer stations and receiving locations could be reasonably secure that the materials they were handling weren't fresh and therefore didn't pose a bioaerosol risk.
Next one is, could you explain further why emergency services were not allowed in the site, even during emergency situations? I think someone's picked up something from something you said earlier.
So it may have been, so the commentary I did on the HWRCs with the traffic management wasn't, so we had to make sure that if we had a problem on site and needed a fire engine or an ambulance, that we could give them access. So making sure that whatever we did on site, whatever we did with the traffic behind it outside our site, that we didn't stop the central services doing their job, be it attending us or attending a neighbour or getting past our site to somewhere else. So traffic management, so I think it's maybe picking up at that point. So we didn't stop people coming. Essential services, we were making sure that they could come and we could give them access and we could get rapid access if we had an accident or something. But if you have if you have a long queue of traffic, and your ambulance is delayed by 15 minutes, that could be critical. So we wanted to make sure that we manage traffic to make sure that they can get there as quick as possible.
Someone's made a comment here about, it's a bit of a left field, this is coming from the side. In the challenging circumstances with regard to recycling in the Far East, how have you managed with recyclable products? So I think that that question has been said, that has that affected your the process of recycling downstream?
So is that a question in the Far East, or is that a question in the UK?
Obviously the assumption being made that we ship our materials to the Far East for recycling. This thing about plastics don't have a home here, they go abroad. So that's why that's why it's a bit left field.
Okay.
It's kind of,
So it depends on it depends on the materials. Obviously, a face mask is a mix of fibre and plastic often. Some of the screen face shields are all plastic. Certainly for us, some of those plastics, some of them are complex composites, which are quite difficult to recycle. But certainly for us, none of our materials go abroad. And if they do go abroad, the small amount that do go to Europe. In that sense, so it wasn't an issue for us, but our general recycling system can't cope with the fibre plastic composites in face masks and things like that, and gloves. Although there are sorts of recycling solutions for the latex or butyl gloves, they require separation. And we're not set up to separate them in the general mix, so you have to collect them separately. Yeah. So the encouragement was for them, if they want them treated differently, then we collect them separately, which is the service that is provided.
I think the debate and discussion about where our recycling materials go around the world is for another day. I think that's a bigger question. I think a political one could argue as well. Do you think is there still goodwill between the public are showing to your crews, your teams? Or has the old-fashioned negativity come back to your workers and you're here to do it? Or is it still positive?
I'm not sure. I recognise the general negativity comment. I think the neutrality was. Yeah. So I think. Yes, I think it's obviously the passion's gone down a little bit as people have tried to return to normal. But I think we still see respect, and I think that's now embedded. They kind of recognise the role. Not everybody will like the bins being collected at 7 in the morning, but we have to start those times sometimes to get around the round and do it in a period. But no, I think it's calmed, which is naturally what you'd expect. In the same way that the clapping for the NHS has gone away, it doesn't mean that people still don't have reflecting. So I think we've still got a bit of a boom from a bit of a bubble that continues to that.
Overall, in terms of recycling rates, where we are now in terms of recycling rates across the piece, where are we in relation to where we were coming into all this?
So we haven't had all the data yet, but I think what we'll see is a bit of a stutter in the recycling rates. You saw some of the collections go down. You saw we'll have more residual waste because we're encouraging people to put PPE into their residual waste. So as recycling as a percentage of those materials recycled by weight to those that are residual by weight, if your residual goes up, your recycling will go down if you were doing the same volume. So I suspect in some places we'll have an increase in recycling, but overall I suspect they've either stayed stable or stuttered a little bit just for that period. Probably not with the dry recycling, I'll be honest, but with we've got no way of recording home composting. So green waste counts towards your recycling. If you compost it at home and we don't collect it, then the tonnage doesn't count towards the recycling, even though you recycled it at home. It's one of those flaws in the system. So there'll be a little bit of stutter, but we see green waste flutter anyway. So if we have a poor growing season in the gardens, then we have less green waste and the recycling figures go down. And if we have a really good growing season in the gardens, we get a lot more green waste and the recycling figures go up. So we used to have the degree of seasonality on that. And we had quite a big Indian summer at the start of the year.
In terms of someone here making a comment about the attitude from local authorities, with the increase in collective waste and residual waste produce, there's a feeling that one or two county councils have been less than sympathetic regarding theirs and their customer needs for increased waste collections. So has there been a negative attitude from certain local authorities?
Not in my experience, and not only I have experience beyond our own authorities, but I've seen nothing but it was all together at the start. They will have stresses and strains. They'll have budgets set on normal waste arisings, and now they've got more waste arisings. So there will be some budget constraints that will no doubt worry them, because it's our money they're spending on our behalf. I've seen no negativity. It's been constructive. Where we've need to do service changes to maintain essential services, they've worked with us. Where we've been in mobilisation, say at Somerset, the customers worked with us very closely to make sure that we did the best that we could do considering all the constraints. So no, I think if anything, it's shown that the sector is resilient and does talk.
Okay, I would ask no more questions, please, from people. Please, no more from them. I will not answer any more that have come in from this point now. So we have sort of some left in there. Some yes nos. If we can do as a yes no session here. Has every driver within your company been trained by Toolbox Talk or external training on COVID-19 subject field, and does each driver need to exemplify specific housekeeping standards in keeping with new government processes? And I'd add, is there still appropriate monitoring to make sure all that's done?
I think that's a yes, yes, and yes.
Thank you. I'm not going to type these in. I'll get used to that. I'll get in trouble here. Ian mentioning about engagement of staff during the risk assessment and safe working procedures. Can you give a one-liner on how their feedback was taken into consideration? Because the workers will have been obviously worried as well. I mean, how did the engagement take place?
Yeah, and we've done numerous webinars. We've done certainly on the return to work. We've done a big survey of our staff to understand from those that have been furloughed or working at home how to introduce them back into the system. And we've done a kind of a gradual back to work process. We've done resilience webinars. We've got external speakers in to give webinars and tutorials on mental health and other things. So I think our sector is quite used to hygiene in many ways. So to this was a tightening of what we normally do, rather than a dramatic change in that process. So no, I think we've done the best we can. Some people are more worried than others, and you have to kind of take a slightly individual approach, but then you also need to get people working and encouraging. And I must say our IT systems in Suez have done remarkably well, considering the fact that we moved a huge proportion of staff who worked in offices out and gave them the ability to continue their job from home with the right IT and the right services and the right bits and bobs, which wasn't part of anybody's contingency planning prior to it.
A very brief one here from Annie. Do you have any advice on commercial waste produced in the household whilst working from home? We have sales staff carrying out online demonstrations of our products producing waste materials.
So the law is, as far as I understand it, is if you are working from home but not carrying out business from home, then the waste is municipal. If you're carrying out a business activity at home, then you have to separate your business waste and pay for it separately to your domestic waste. The nuance here is whether they're working at home or carrying out a business at home. A doctor, for instance, who consults in a room and has gloves and masks and things because he's using a room for business, and he's undertaking a business activity with people that come to that, would be having to have a separate business collection. I haven't come across the sample issue in that process, but if it's significant, then it may be classed as carrying out a business at home and therefore require separate collection.
Next one here. I think the answer is yes to this one as well. Has the work routine changed? Is workers' moral influence somehow, and that reflects performance? Thank you. So I think that...
so we've seen, I think all the people that work from home or work from strange locations at the start, it was a Dunkirk spirit, if I was to use an old phrase. I think I've seen it. I think my office at home went from an office at home to a cell if I worked too much at home and didn't get out enough. And we've seen, I think people need a bit of a mix. So we're not going to encourage people to work from home continually. We think they need to come in and generate some of the team activity and some of the cross-pollination. Some of the, Lord Sugar did a good article. I think some of the parts of his article were quite good in terms of informal learning. When you sit into a meeting, hear other people speak, or you're part of a conversation, but not as you're generating it. I think digital generates more digital communication, so I can invite you to a call, but the person who sits next to you who might join in occasionally only gets invited to the call if I invite them, and it becomes a bit more formal. So there's a lot of informal learning that happens, which doesn't happen at home working. So we're keen to make sure that we kind of get a blend, but we're not requiring everyone to come back to work as normal at this point in time. And probably we'll have a new normal when we finish up anyway.
Okay, getting close to the end here. I'm down to the last 3 or 4 questions now. Which guidance advised that staff should cease assisting customers with depositing waste on the household waste recycling centres? Have you followed this guidance? And if so, what arrangements have you put in place for disabled, vulnerable customers who will not be able to physically climb gantry steps, etc., to tip their waste? You did touch on this, didn't you, about what they can do to help?
This was probably one of our biggest angst when we're looking at HWRCs. Is what we often provide is for people that are infirm or unable to lift material or move material or need assistance, is we provide that assistance for them. So we'll have people that either lift it for them or help them lift it. Obviously, that's not possible with social distancing. We encouraged them where they didn't need to come, not to come. And then a number of the councils made special provision for them. On our HWRCs, where possible, where we can redesign them to do so, then we've tried to remove steps, trying to remove the hazard so that you walk flat and then tip over a fence. But some of the older ones, or some of the ones that where we can't develop split level, there are still steps and gantries, in which case it's still a work in progress on how to deliver that. We've encouraged people that couldn't lift it themselves to bring someone with them that can. So someone from their bubble that can assist them.
Okay, we're going to the last couple now. Robert, you explained a lot of the detail, the increased demand for services the lockdown created. This obviously must have impacted on staff increasing their workload. What measures were put in place to manage workload and stress level? And my little note here is, I think, as you mentioned, when we started this, there was a lot of adrenaline going. People were into the emergency. Everyone was up for some extent, weren't they? But because downstream, how in terms of workload and stress must be kicking in now, and also getting leave in for people.
Yeah, so I think very much so. So whilst we were trying to work out what new meant, and we were doing a lot of work to try and gather that data and understand it, and part of my job is to do that. So I was getting all this data in, trying to interpret it and say, okay, what's happening, and is it going to stand on? How long does it will last? And is it a bloom or is it a bust? What we try to do is reinforce the crews, or as I said, change the collection method, so that we could, stillage vehicles don't really compact very much, but a co-mingle collection can when you put all the materials together. So when we moved some of the crews or some of the systems to co-mingling, it allowed us to do the same job with more wastes with the same or fewer crew, and therefore even out the demands on the crews. So we worked very hard, and our operational teams and health and safety teams worked very hard to get back to a normal level of activity. And part of that was just this adaptation to how we do that. We could shorten the rounds or lengthen the rounds or that process, but whilst you're still learning and still understanding what it looks like, we were having to rely on them to do a bit of overtime for us here and there just to make sure that things worked.
And the last question is really mine here. I'm going to reserve this to last. I think the biggest challenge, having seen in my district where I live, and only one or two people know where that is, there might be people from the council listening in. My concern was that other health and safety risks that were being managed might not have been managed as well. And I think the example I had, especially with the increase in waste, I saw people, loaders, crossing roads, running across roads between cars for streets that should have been double side collection. I felt had been compromised. So it should have been single side collection, being compromised by double side collection. Was that a concern for you, that would we all be focused on one risk, but other risks we might not be putting the effort in, or taking shortcuts because of the workload?
So we encourage our staff to follow all of our normal procedures. So if we have single side loading, that we encourage them to do that. And then we try to manage the resources and the support of them to make sure that what they couldn't do in the hours or what they couldn't do within the capacity of the truck, we accommodated in different ways. And then we work with the customers to do that. So that shouldn't be the case. And buddying up was also, so I think when people are trying to be helpful, so the idea of buddying up was to make sure that when people, that instantaneous reaction, oh, I could just get that one because it's close. You want your buddies to go, no, we're doing this side of the road down this way, and then we'll come back the other side. We'll get it on the way back. Don't worry about it. And that's part of the reason that we buddy people up, because some of the crews that were moving from other activities wanted to be helpful, felt really valued, I think, in coming into an essential service and keeping things going. But we just needed to temper their enthusiasm to be overly helpful and remember the training. So again, having someone who does it every day and knows the rules on municipal, which is very different to commercial, and buddying them up. So we didn't see that as an issue in practice, but we didn't change any of our operating procedures. We just overlaid the COVID ones and tried to manage the resource consumption issues.
That has been great. At this point, I'm going to say, been great and appreciated you sharing your experiences, how Suez have dealt with everything. You've taken a good 40 odd minutes of questions, which I actually prefer the question, but I think we get a lot more things from people from two areas, from EWMG people and the people from the public sector side. I appreciate it's not quite the Andrew Neil interview show here. We aren't quite as, haven't had those resources and money. But at this point, again, Stuart Hayward-Higham, thank you very much for giving up an hour and a half of your time. And I hope we can catch up again face to face, and actually maybe one of our branch meetings come along to and meet you in person. Thank you again very much.
My pleasure. Thank you.
Take care. Bye-bye, everyone.